Hello and welcome back again. So as I promised earlier, we are going to go through breast cancer today. So breast cancer by definition is when breast cells mutate to become cancerous cells, and then they multiply to form tumors. Tumors are growths, okay? So we are going to look at the types of breast cancers. So we have ductal carcinomas. These are cancers. This cancer starts in your milk ducts, okay, and spreads to the nearby breast tissue. So the classification, or rather the types, are from where the cancer or the tumor starts from, okay. And the invasive ductal carcinoma is the most common breast cancer, okay. Then we have lobular cancers. So these are cancers that starts from the lobes, okay. And these lobes are the ones that produce milk in the breast. Then there are quite a number, but generally these are just the originating parts in the breast, okay. So I'll just go direct to the signs and symptoms. When should you be suspecting that this could be breast cancer, okay? This will help in early diagnosis and treatment. Remember, breast cancer is one of the curable cancers when it is diagnosed early at the earliest stage. Now, let's look at the symptoms and that you need to look after. These are as follows. One is change in the size, shape, and the contour of the breast, okay. You might find that one of the breast is bigger than the other one, okay. It is, and the size is gradually increasing. So that's a worrying sign that you should that tells you that you need to go and talk to your healthcare personnel, okay. Another sign is a mass or a lump, okay. A mass which feels very small. It starts as a small mass and then it gradually increases in size. So when you do breast examination, which I'll be showing you after this video, I'm going to show you how to do a breast examination for you to be able to identify a lump or a mass, okay. Another sign is another sign is change in the look or feel of your skin on your breast or the nipple. Your skin may look dimpled, scaly or inflamed. It may look red, purple, or darker than the other parts of your breast. So when we are suspecting a malignancy of the breast, you'll find that some parts of the breast have changed in terms of the color, and when you compare with the other breast, it's completely different, okay. So some parts may appear darker. You may feel you may experience some inflammation. You may experience some scaling of the skin on the affected breast. So these are the warning signs that should tell you that your breast needs to be examined, okay. Another thing to look after is a blood stained or clear fluid discharge from your nipple. When you do self breast examination and you squeeze your nipple and find abnormal discharge, it could be blood, it could be clear fluid, or any other discharge that is not milk for the lactating mothers. Any other fluid that does not look like a normal fluid is a sign that you need to seek health care assistance for you to be able to rule out whether this is malignancy or not. These are just the symptoms, but when you experience these symptoms, it doesn't mean that you literally have cancer of the breast. However, there are warning signs that should tell you that you need to go and consult from your doctor about the abnormal feeling or the abnormal occurrence in your breast. Okay, so we are going to narrow down into the causes, or rather the risk factors. When I talk of risk factors, these are factors that predispose you to cancer of the breast. Okay, they are not a guarantee that these are the things that bring about the breast cancer, but they are things that can lead or can facilitate into having a breast cancer. One is the age. People age 55 and older are at more risk because they have reached menopause. Another factor is sex. Women are more likely to get breast cancer than men. However, men also, as I mentioned earlier, they are also candidates for breast cancer. Okay, then we have family history. If your parents, siblings, children, or close relative have had breast cancer before. We have genetics. Up to 15% of people with breast cancer develop the disease because they have inherited some genetic mutations from their parents. Okay. Another cause is smoking, tobacco, drinking beverages containing alcohol, okay, obesity. So you need to manage your weight. We have radiation exposure. What is this? This is if you've had prior radiation therapy around your head, your neck, or chest. These are a factor that can predispose you to getting breast cancer. Then we have hormone replacement therapy. For people who have hormonal imbalances, the treatment they usually get is hormone replacement, or rather hormonal therapy. So hormonal therapy is something also that can bring about or can predispose you to getting breast cancer. Let's look at how we are going to diagnose breast cancer. One of the diagnostic tests is breast ultrasound, which we call a mammogram. So you visit your healthcare you visit a healthcare facility, get a physical examination done, breast ultrasound. Then we have breast MRI, or rather magnetic resonance imaging of the breast. Then we have breast biopsy, whereby the growth or the mass that is on your breast is picked, or rather pricked and taken to the lab for analysis. Then we have immunohistochemistry. This comes alongside with the biopsy that is taken. They go and identify whether it is cancerous or not. Then we have genetic tests to identify mutations that cause breast cancer. Let's look at the stages of breast cancer. We have stage 0. There are usually 5 stages. One of the stages is the stage 0, and at this stage the disease is non-invasive. What does this mean? It means that it has not spread from your breast ducts or other parts of your breast. Okay, from where it has originated on your breast, it has not spread in any other part of your breast. In stage 1, there are cancerous cells in the nearby breast tissue. If it is started from your duct, it is now in the lobes, okay, or any other part of your breast. So stages 0 and stages 1 are the most curable point of breast cancer. That's why, as I mentioned earlier, you need to go get checked and get early diagnosis and treatment. We have stage 2, where the cancerous cells have formed a tumor or tumors, and the tumor is either smaller than 2 centimeters across and has spread to underarm, right here on the lymph nodes, or larger than 5 centimeters across but it hasn't spread to the underarm or the lymph nodes. The lymph nodes are right here.